Hello everyone, welcome to AY Tutorials. Today we are going to see the impact of alcohol on the liver. Here in this video, I have mentioned the functions of liver. There I have included some introductory part also, and then what kind of changes that occurs in the liver after the consumption of alcohol, then some information about the fatty liver, alcoholic hepatitis, and some consequences of the liver damage. Then what is alcoholic cirrhosis, hepatic encephalopathy, and much more. So do watch this video and let me know in the comment section if you like this video. So now let's start with the normal functions of the liver. The liver is the body's powerhouse. First function is the metabolism. Liver is the primary metabolic organ processing carbohydrates, fats, proteins, and it converts the glucose into glycogen for the storage, synthesize cholesterol, and produces the essential proteins like albumin. So, this liver is responsible for the various body functions, which includes the metabolism, as it processes the carbohydrate, fat, and proteins, and it also produces the albumin, and it synthesizes the cholesterol. Then it also converts the glucose into glycogen. Then second one is the detoxification. This is one of its most critical roles. The liver, it filters the toxins, drugs, and waste products from the blood and converting them into the less harmful substances that can be excreted. So whatever the food, drugs we are going to have it, then it can be detoxified by using the liver, as it converts them into the less harmful substances, and then those products can be excreted from our body. These are the two main functions of the liver. Introduction. The liver is the remarkable and resilient organ performing over 500 vital functions in the body. However, its capacity for regeneration is not limitless, especially when faced with the toxins like alcohol. Alcohol disrupts normal liver function. The changes it induces the systemic consequences of the liver damage and available treatment options. So now functions. Bile production produces the bile, which aids in the digestion and absorption of the fats and fat soluble vitamins in the small intestine. This bile production is very important, as in the small intestine bile aids in the digestion and absorption of the fats. Bile emulsifies the fat, and this is the physical, not chemical digestion. Fat emulsification increases the surface area for the chemical digestion of the fats by the lipases, and bile is made in the liver and stored in the gallbladder. Then next one is the storages. Liver stores the vitamins like A, D, E, K, and vitamin B12, then minerals like iron and copper, and then glycogen also. Then immune functions. It contains the specialized immune cells like Kupffer cells that removes the bacteria and the other foreign substances from the blood, and playing a crucial role in the immune system. So these Kupffer cells, they remove the bacteria and other foreign substances, whatever the substances are there in the blood, that can be removed by those Kupffer cells, and this is how it works. Then synthesis. Liver synthesizes the clotting factors which are necessary for the blood coagulation. Alcohol's assault, that is changes in the liver. Changes in the liver after the alcohol consumption. Whenever alcohol is consumed, it is primarily metabolized by the liver, and this process, it generates toxic byproducts and initiates a cascade of damaging the events. Fatty liver, it is also known as the steatosis. This is the earliest and most common response to the excessive alcohol intake, often reversible if alcohol consumption stops. So this fatty liver is occurs due to the excessive alcohol consumption, and it can be reversible if the consumption of alcohol can stops by the person or the patient. Then alcohol metabolism, it disrupts the normal fat metabolism in the liver, which leads to increase in the synthesis of fatty acids and decrease the breakdown of fats and impaired export of the fats from the liver cells. Then appearance, accumulation of the triglycerides within the liver cells. Symptoms, often asymptomatic but can cause the fatigue, weakness and discomfort in the upper right abdomen. If too much of the fat buildups in the liver, it can lead to the inflammation and which can causes the complications. Certain changes in your diet and exercise routine can help to reverse this condition. This fatty liver, it happens when fat buildups in the liver, and having small amounts of the fat in your liver is normal, but too much can become the health problem. Your liver is second largest organ in the body, and it helps the processes to process the nutrient from the food and drinks, and filters the harmful substances from the blood. But too much fat in the liver can cause the liver inflammation, which can damages your liver and create the scarring, and in severe cases this scarring can lead to the liver failure. When this fatty liver develops in someone who drinks a lot of alcohol, it's known as the alcoholic fatty liver disease. And in someone who doesn't drink a lot of alcohol, it's known as the non-alcoholic fatty liver disease. Alcoholic hepatitis. It is the more severe inflammatory condition that can occur after the prolonged heavy drinking, and it can damage the liver permanently also, and it can range from the mild to life threatening. Alcoholic hepatitis is nothing but the swelling and called inflammation of the liver caused by the drinking alcohol, and drinking alcohol can destroy the liver cells. Mechanism, acetaldehyde, which is the toxic byproduct of the alcohol metabolism, and other reactive oxygen species, can cause the inflammation and damage to the liver cells, that is hepatocytes, and immune cells are recruited, further contributing to the inflammatory response. Appearance, swelling, inflammation and destruction of the liver cells, presence of Mallory bodies, that is the damaged intermediate filaments, and infiltration of the white blood cells. Symptoms, symptoms of the alcoholic hepatitis includes fever, jaundice. Jaundice is nothing but the yellowing of skin and the eyes. Then nausea, vomiting, abdominal pain, fatigue and loss of appetite, and can lead to the liver failure also. This alcoholic hepatitis is most often happens in the people who drink heavily over the many years, but the link between drinking and the alcoholic hepatitis isn't this simple. Not all heavy drinkers get the alcoholic hepatitis, and some people who drink much less, they can also get the disease. People with the alcoholic hepatitis tends to be malnourished. Drinking large amounts of alcohol keeps the people from the being hungry, and heavy drinkers get most of their calories from the alcohol. Consequences of liver damage. Liver damage, particularly cirrhosis, has the far-reaching the effects on almost every part of the system due to the liver's central role. Alcoholic cirrhosis. It is the most advanced irreversible form of alcohol-related liver disease, which is characterized by the widespread scarring that replaces the healthy liver tissues. The chronic inflammation and repeated damage lead to the activation of hepatic stellate cells, which produces the excessive collagen and other extracellular matrix problems. This leads to the formation of fibrous bands that disrupt the normal liver architecture. Appearance, whenever this alcoholic cirrhosis occurs, then there is the shrinkage of the liver, then nodular liver with the excessive scar tissues and impaired blood flow through the liver. Symptoms, it is often asymptomatic in early stages. As it progresses, the symptoms includes jaundice, ascites, that is the fluid accumulation in the abdomen, then encephalopathy, that is brain dysfunction due to the toxic buildup, then variceal bleeding, that is bleeding from the enlarged veins in the esophagus or stomach, and easy bruising and fatigue. This can end stage of the liver disease. Effect of alcohol on nervous system. It includes hepatic encephalopathy. It is nothing but the brain dysfunction caused by the accumulation of toxins like ammonia that the damaged liver can no longer remove, and symptoms ranges from the confusion and disorientation to the coma. So this hepatic encephalopathy is the brain's dysfunction caused by the liver dysfunction. Encephalopathy is brain's dysfunction and hepatic means liver related. Encephalopathy affects your central nervous system and how you think, feel, and act. Symptoms can range from the confusion and disorientation to the erratic behavior and personality changes to coma. It can get better with the treatment, but it can be life threatening without the treatment. Hepatic encephalopathy is caused by the neurotoxins in your blood. Neurotoxins means the substances that are toxic to your brain and the nervous system. Normally, your liver filters these toxins from the blood, but if your liver isn't performing this function, then as usual, the neurotoxins continue to circulate and eventually they enter and affect your brain. And this usually happens in advanced liver disease when liver functions begin to fail. Gastrointestinal system, in that portal hypertension, increased pressure in the portal vein which carries the blood from the intestines to the liver due to the scar tissue obstructing the blood flow. So portal hypertension, portal vein is there in the liver, and the increase in the pressure on that vein is nothing but the portal hypertension. Then ascites, fluid accumulation in the abdominal cavity due to a portal hypertension and low albumin levels, as the liver produces albumin. Then esophageal varices, enlarged fragile veins in the esophagus and stomach that can rupture and cause the life threatening bleeding. Then malnutrition, impaired absorption of fats and vitamins and loss of appetite. Let's see how alcohol affects on the circulatory system. Coagulopathy, impaired blood clotting due to the liver's inability to produce the clotting factors. As we all know that clotting factors are synthesized in the liver. So due to the impaired function of the liver, there is the inability to produce the clotting factors, and which leads to the easy bruising and bleeding. Then anemia, due to the chronic bleeding, nutrient deficiencies, or the direct bone marrow suppression can be occur. On renal system, hepatorenal syndrome, a severe complication of the advanced liver disease where the kidneys fails due to the impaired blood flow, not primarily the kidney damage. On immune system, increased infection risk, impaired immune function due to the Kupffer cells dysfunction and overall immune suppression, making the patients more susceptible to the bacterial infections. As we all know that whatever the Kupffer cells are there in the liver, they are responsible to remove the bacterias or the foreign materials from the body, and due to the impaired function of the liver, this Kupffer cells dysfunction occurs. On endocrine system, hormonal imbalances, it affects the metabolism of the hormones which lead to the issues like feminization in men due to the impaired estrogen breakdown. Possible treatment strategies depends on the stage and severity of the liver damage. The constant of the treatment for all the alcohol related liver diseases is complete abstinence from the alcohol. Liver transplant, For carefully selected patients with the end stage alcoholic cirrhosis who have demonstrated the sustained alcohol abstinence and meet other transplant criteria. This is only for definitive cure for advanced cirrhosis. Then supportive care. It includes nutritional counseling, vitamin supplementation, regular monitoring for liver cancer, which is the risk factor with the cirrhosis. Psychological and addiction support. Counseling and therapy. Addressing the underlying alcohol dependence is paramount for sustained recovery. Support groups such as Alcoholics Anonymous, then medications like naltrexone, acamprosate, or disulfiram may be used to help to maintain the abstinence. Conclusion. The liver's resilience is extraordinary, but the chronic alcohol abuse can push it beyond its limits, leading to the spectrum of conditions from reversible fatty liver to the life threatening cirrhosis. Understanding the progression of alcohol related liver disease, its systemic consequences, and the critical importance of the alcohol abstinence are the key to prevention and effective management. Early intervention and comprehensive support are the vital for improving the outcomes and preserving the liver's indispensable functions. Liver is very important for the body, as maintaining the liver health is very crucial, as liver's dysfunction can lead to the serious health issues. So regular checkups and balanced diet and avoiding the excessive alcohol consumption can protect this vital organ. If you like this video, please like, share and subscribe to the AY tutorials. Thank you.